Okay guys, one last video. This is just gonna go over like actually setting up for the Bronx, and I have all of my supplies. I'm actually gonna set up for it. This is not a requirement on the midterm. This is just for your guys' information. So, I can get this situated. Just give me a second. We're almost there. Okay, so here's all my supplies laid out on my table. So now what do you actually do with all of this? So I'm going to crack open my sodium chloride. These guys come with 2 caps on them. That way you know whether it's been opened or not previously. So you open up your first cap, and then you take off your second cap. Then I'm going to pour a little bit of sodium chloride into my MSS basin. Again, I try not to like touch things. I have gloves on when I'm doing all of this in real life. I'm going to take all my syringes. And I'm going to label them. So my 10 ml syringes are specifically for your lidocaine. It is not a big deal if you only grab like one of these syringes and you use one syringe for all 3 doses of lidocaine. But it is nice to have an individual syringe for each dose so they're ready to go ahead of time. So I label everything with this, so this is why you have a Sharpie. So I'm going to label one 4%, and then another one 2%, and then 1%. And then I also label my specimen cups for my lidocaine as well. So with these guys, normally they come with a paper label, so I just label it on there. So once all my cups and my syringes are labeled, then I'm going to actually get my medication, my lidocaine medication out. So again, you can pop the label or the metal cap off with a bottle opener, or you can use a needle and a syringe and manually pull it out. That does take a little bit of extra time, so I usually just pop the cap off and then you kind of just shake it out a little bit. So then you're gonna put all your medications in the appropriate jar or specimen cup. The procedure, again, remember, is 4% above your vocal cords, 2% below your vocal cords. Sometimes doctors prefer different things, but that is like the textbook standard. When you instill lidocaine down the scope, especially if you're doing above the vocal cords, you want to try and time it out so you hit the cords when they're closed. So you kind of want to like give it a second and watch your patient's breathing, and right before you think they're about to close their vocal cords down, you shoot your medication in. Typically, you do about 1 to 2 mLs of lidocaine at a time per dose. Some doctors have a specific dose that they prefer. And then when you do that, you're going to get, so say they want 2 mLs, you're going to get your 2 mLs of lidocaine, and then you're going to fill the rest of your syringe with air. So you do 2 mLs with then 8 mLs of air behind it. This gives your solution or your lidocaine just a little bit more oomph to actually like get all the way down past those vocal cords. Otherwise, it just kind of trickles out and doesn't get where it needs to get. So remember, 1 to 2 mLs of lidocaine with 8 or 9 mLs of air behind it. Once I have my lidocaine all set and ready to go, I'm going to open up all the rest of my syringes. So again, I have enough 10 ml syringes for all of my different doses of my lidocaine. Your 20 ml syringes, you're going to have enough for a BAL if you end up doing a BAL. And then you have a couple of extras for this MSS basin. You have an MSS basin with the sodium chloride for if like the scope gets clogged up with mucus or like there's a bunch of spit in the field, this can help clear it. So normally, if the doctor needs to just clear the field, you usually do about 5 mLs of your sodium chloride with, again, air behind it. So you do 5 mLs of sodium chloride with 15 mLs of air. So you would just draw up your 5 mLs. So I have 5 mLs of sodium chloride, and then I'm going to do 15 of air behind it. So when I push it in like that, it has some force again behind it to not only help clear the secretions, but clear my view, my field of view. So these, I usually get 2 of these out, and you can like pre-charge them, so to speak, and then you just set them on the edge of your emesis basin. So you have 2 to go, so you kind of like preload one and have it ready to go, especially if you have a partner RT with you who's assisting you as well. Sometimes there are 2 RTs in Bronx. So like one person can kind of be doing this while the other RT is handing or instilling the stuff down the scope. Again, depending on what doctor you work with, some doctors want you to actually push the stuff down into the scope. Some doctors want to do it themselves. So you'll just learn that as you work with the doctors. Your lidocaine gel. So this is not actual lidocaine gel. Again, I don't have any, so we're just pretending. This is for if your patient is not intubated. So prior to the procedure, right when I'm done, usually with my nebulized lidocaine to help numb their airway, I will put some of this into a syringe. It comes in a better tube, so you can put it into a syringe. But you put it into a syringe and you shoot some of it up their nose. Again, you're going to want to ask your patient, do they have a deviated septum? Do they typically breathe out of one side of their nose versus the other better? Just any indication that one side might be more accessible than the other side. So you're going to put a little bit of lidocaine up their nose, lidocaine gel up their nose, and then kind of tell them to take a big old sniff so it really gets back up into their airway. If your patient is intubated, you do this lubricant. I said in my previous video, I believe to put it down the tube. You do not put it down the tube. This is for your scope. So you push this on the end of your scope, but it's 4 ET tubes. Obviously, if your patient's awake and you're doing a bite block, you just put this in their mouth. So the part that sticks up goes in their mouth, and then this just wraps around their chin or their neck, sorry.